Hi everyone, good afternoon. Am I audible and visible, guys? Okay, so welcome back to another episode. Today we are going to study Epid today, and I have brought in almost everything that could come in your exams. Alright, so you just have to listen, try to solve the questions, and let's see how you do. Okay, give me a thumbs up if all of you are ready, guys. Okay, so without taking too much of your time, yes, happy Doctor's Day to everybody. This is also for NEET PGs. A lot of you asked me, Pratiksha, so I had conducted a short NEET PG a couple of days back when NEET PG was just round the corner here. But then if you missed out on that NEET PG short, you can attend the Fmge short also. Alright, so let us start, and happy Doctor's Day to everybody. Now we are following this PSM short series. We are done with vaccines. Today we'll be conducting Epid. I will also be giving you at least 4 numericals today, and that's how the schedule goes. And 8 p.m. you will have the Telegram quiz, and the PDF will be shared on the Telegram group. The link to my Telegram group is in the description box below. Okay. Alright, so the first question coming up, everyone, can you do this? Match the following. Just give me 1 second. Single page. Yeah, the first question out, match the following. So the first topic that we are going to revise is classification of study designs. Okay, classifications of study designs. Let's see if you can do this one. 1 second. Okay, just you have to give me 1 moment, please. Okay, have you finished? All right. Oh, I forgot to share the PDF. Just give me 1 second. I will share the unannotated PDF on the Telegram group as well. Just a moment, guys, so that those who want to write, you can write along with the presentation. Okay, I'll just share it in 1 second. It's not downloading. As soon as it finishes, I will send it. Yeah, it has been sent to the Telegram group, the unannotated PDF. You can check it out, guys, and keep marking along with me. Okay, so everything done. Now back to the question. So what have you marked over here? I have uploaded the PDF, the unannotated PDF on the Telegram group. Very good. Randomized control trial. Some of you are writing B, some of you are writing C. Let's see what it is. RCT, everybody knows, is an interventional study design or experimental study. Okay? Case series, guys, is a descriptive type of study designs. Alright. Now, if you have to talk about field trials, okay, if you have to talk about cohort study come to observational type of study designs. Okay? Now यहाँ पे थोड़ा सा mismatch हो गया है. Alright, RCT is also interventional, case series is also, so 2 का B everywhere we have. Randomized control trials is not analytical. I will just change because field trials are also interventional. Okay, so yeah, thoda sa mismatch ho gaya. I'm really sorry for that. What I'll do is, let me put this to, we can do one thing. Let me put this another option over here, cross-sectional study. Okay, cross-sectional study. Now cross-sectional study you could take to any of the study. We will put it as cohort study ko we will take it as analytical, cross-sectional ko we can put it in observational. Okay, there was a slight mismatch, so don't go by this one. One RCT का we will go for interventional study design, case series का descriptive हो गया. Let's take up 3 cross-sectional for observational and 4 cohort for analytical. Is that okay? So there was no answer to that. Maybe while making I missed out something. So did you understand this one? Let us once revise the classification of study designs. That is very important for you. So sorry for the question framing थोड़ा सा वो हो गया. All right, no problem. Let's try to classify the study design. So you all know the first one that we have is you have to observe. The first one is observational. We observe someone. Then we start talking to that someone. So interventional. Interventional, or you could also say experimental. Okay? Now when you have observational, you will have two things: descriptive, you will have analytical. Descriptive, analytical. Descriptive, analytical. Now when COVID happened, we didn't know that it was COVID. We first described it in terms of what? Time, place, person. And what is the buzzword for descriptive study design? Exam में आज मैं आपको बहुत सारे buzzwords दूंगी which will make it easy for you to mark in the exams. Okay, so if you see the word distribution, if we have to study distribution of disease, it is descriptive study design. ठीक है? Analytical में we answer why and how. Another question which was asked once: what is the difference between a descriptive study design and an analytical study design? So remember, analytical study mein we have to do an analysis. So we will always have a comparison group with us. Descriptive, we will never have a comparison group. It's just one group that we are talking about. We will never be able to compare. In analytical, we have a comparison group. Now, example of descriptive: one individual we study with a disease, case report. Collection of such individuals we study, case series. Okay? But when you have analytical, we will talk about determinants. We will talk about determinants. So we have 3 C's and 1 E. What are the examples over here? Cohort study, case control study, the 3 C's: cross-sectional study, ecological study design. ठीक है? The 3 C's and 1 E. In interventional or experiment, we are actually doing something. So the first one, हम लोग actually कोई intervention कर रहे हैं, RCT. RCT is phase 3 of a clinical trial. RCT के बाद ही drug में market में drug आता है. Drug is launched after RCT in the market. Then you have field trials. Field trials is which one, everybody? Field trials is your vaccine trials. And of course you have community trials. Community trials are preventive trials. Community trials are preventive trials. Community trials are preventive trials. एक community को I'm going to give prophylactic iron folic acid and I will not give it to the other community. Everyone look at me. Remember the time when COVID was there? Okay, now 2019 later part, we didn't know it was COVID. हमें पता नहीं था as epidemiologists, as researchers that it was COVID. We called it as pneumonia of unknown origin. So epidemiologists noted that some form of pneumonia is increasing. So they described it in terms of time. Winter months, Wuhan, China, male population in the bird market. Then they compared people who suffered from the pneumonia to those who did not suffer from that pneumonia, and then they found out that okay, it was COVID. All right, and then they started making drugs and vaccines. Clear? So the first thing always that you have to revise is your study designs. Kabhi bhi question aaya, don't mess it up. Just remember this one example of study designs. Here I want to give you 2 buzzwords also. Please remember. Agar exam mein they ask you, try to answer in the comment section. What will be your study of choice if there is a new disease or a disease of unknown etiology? What study design would you want to conduct? आप कौन सी study design करना चाहोगे अगर कोई अभी new disease आती है या disease आती है of unknown etiology, all right? So my first preference, our first preference would always be which one, guys? Descriptive study. ठीक है? So distribution and new disease of unknown origin, we don't know the etiology of it. We would always want to do a descriptive study design. ठीक है? चलो, let's go to the next MCQ for the day. Okay, one more buzzword I want to give you over here. All study designs have individuals as unit of study except anybody, except all study designs have individuals as unit of study except, what is your answer? Except, this should be on your tips guys, because this is highly common question, except ecological study design. We will see all the individual study designs today, how to identify. We will be revising that concept, so don't worry at all. In ecological study design, your unit of study guys is पॉपुलेशन. इकोलॉजिकल स्टडी में ना यूनिट ऑफ स्टडी क्या है? पॉपुलेशन. ठीक है. अब हम लोग व्हेन वी विल टेक अप इकोलॉजिकल स्टडी डिजाइंस इंडिविजुअल क्वेश्चंस, आई विल टेल यू हाउ एंड व्हाई. ओके, going to the next MCQ everybody. Let's say came in 2023. Let's see your answers to this one. I'm going to give out the approach to identify the study designs. देखो, listen, you will get a question on identifying study designs. You will, there is no escape. So I am not saying that the same question is going to be picked up. Today I'll make you practice a lot of questions, okay, to identify, to help you identify. So you have to know the approach. What was the approach guys? Whenever you get a question, you have to identify exposure and outcome. You have to identify exposure. Exposure means the risk factor and the outcome. आपको ये identify करना है question में. Second, you have to see is the start of study mentioned. कहीं पे भी कोई year वगैरह mentioned है. You have to check for this, whether some year or something is mentioned or not. Third, you have to look for direction. How will you look for direction? You will be checking out the buzzwords. You will check out the buzzwords. Now what do I mean by buzzwords? Suppose question में पूछा history. हिस्ट्री मतलब वी आर गोइंग बैकवर्ड्स. ठीक है. सपोज क्वेश्चन में आया वर्ड फॉलो अप. फॉलो अप मतलब वी आर गोइंग फॉरवर्ड. सबसीक्वेंट, ऑल राइट, सबसीक्वेंट, वी आर गोइंग forward. Next, you have to always look at the comparison group guys. This is very important. Comparison group. Comparison group matlab if you ever see that we are comparing cases or diseased versus non-diseased, okay, diseased cases या controls non-diseased, ठीक है, तब हमारी स्टडी क्या होगी? इट विल बी अ केस कंट्रोल. बट इफ यू एवर सी वी आर कंपेयरिंग एक्सपोज्ड वर्सेस नॉन एक्सपोज्ड. एक्सपोज्ड वर्सेस नॉन एक्सपोज्ड का मतलब क्या होता है? रिस्क फैक्टर वर्सेस नो रिस्क फैक्टर. व्हाट विल बी योर स्टडी? यू विल ऑलवेज हैव अ कोहॉर्ट स्टडी डिजाइन. ठीक है. Plus you have to also check out, are we talking about rare disease? If you have a rare disease like some cancer, neurological या neural tube defect, इन सबको पढ़ने के लिए to study some rare diseases, what is the best thing that we can do? The best thing we could plan is a case control. If you see that we have rare exposures, if you see that we have rare exposure, name a rare exposure. Occupational exposure. Any question that you get concerning a factory में study हो रहा था, mostly the answer will be cohort, क्योंकि वहाँ पे you have a rare exposure, it is occupational exposure, we will have a cohort. Now I am not saying that all these words are going to be in your study. I mean all the points. कुछ ना कुछ मिलेगा guys. Now I am going to give you some buzzwords over here. I'll also sum up the buzzwords at the end. Suppose आपको मिला word matching. Matching you know is for which study design? If you ever see the word matching, it means that we are talking about case control. आपको cases and control को similar करना है. ठीक है. So if you ever see the word matching, matching means if your cases are from lower class, आपके controls भी lower class से होंगे. If your cases are elderlies, your controls are also elderlies. ठीक है. So these things you have to remember. One more thing I am going to give you here itself so that you will be able to solve the questions. देखो guys, अगर आपने word देखा, if you see the word history, history मतलब ध्यान से सुनना everybody, I am going to tell you how to distinguish between case control and retrospective cohort. ठीक है. Then we will go to solve the questions. If you see the word history, we have to go backwards. Now when you go backwards, it could be a case control, it could be a retrospective cohort. Okay, it could be a retrospective cohort. It could be case control, it could be a retrospective cohort. ठीक है, दोनों में से कुछ भी हो सकता है. It could be a case control, it could be a retrospective cohort. Now for case control, to know that ठीक है answer is case control, we will have buzzword like interviews. Okay, because we have people with us, हमारे पास cases and controls हैं, तो हम उनका interview ले सकते हैं. We can interview them. But if you see the word past records, we are taking out data from past records, old registers. That means वो कौन सी study design है? It's going to be a retrospective cohort. Remember this. In case control, we will start with cases. We will start with what? We will start with, one second, okay? Alright, so we will start with cases and controls. We will start with diseased and non-diseased. And what is going to be your buzzword, guys? Interviews. But अगर आपका retrospective cohort है, we will be comparing what? We will be comparing exposed versus non-exposed. We will be comparing exposed versus non-exposed using old data. Am I clear? Give me a thumbs up. Now I'm going to take you to the questions जहाँ पे आप ये approach लगाओगे and you're going to come to the answers. Alright, everybody, can you give me a thumbs up? Guys, just a second. Somebody was putting some messages. No, that got. Just give me 1 sec. Okay, I'll just set the settings. Yeah. All right. So any of these points could come. Now all these buzzwords I am going to repeat at the end of the session also. सारे buzzwords मैं end of the session में भी repeat करूँगी, तो don't worry. अभी let's go and solve the questions. ठीक है? Now देखो, what was the question over here? A study was conducted to compare MMR vaccine history in children with autism and without autism. What kind of study is being done? Now don't get confused with, vaccine. Ki vaccine means interventional study design. No. You have to see a couple of things. First of all, what is your exposure? Vaccine. What is your outcome? Autism. Now autism, everybody, is a rare disease. ठीक है, rare disease, and it's very clearly written. We are comparing MMR vaccine history in children with autism and without autism. That means I have a group where I have divided autistic children, no autism. ठीक है, I am comparing autistic, no autistic, and I am going and asking their mothers whether they took MMR vaccine or not. MMR vaccine or not. Now you could get confused with the retrospective cohort यहाँ पे, but remember it's not a cohort because आपका comparison group क्या है? Your comparison group is children with autism and without autism. Clear? Everybody, let me take you to one more question. So here you have to make out that it is a rare disease and your comparison group is diseased and non-diseased. Chalo, try to do this one, everybody. Okay, can anyone tell me the answer to this one? Chalo, can anyone tell me the answer to this one, guys? A research study is being conducted on patients in rehabilitation where the impact of addiction among young adults as addressed on their subsequent divorce. Among two groups of study subjects, divorced and non-divorced, the history of alcohol or drug use was assessed. Now, आपको दिख रहा है, there's a buzzword history. That means we are going backwards. Now, when we go backwards, जब भी history होगा, backward की study होगी. It could be a case control, it could be a retrospective cohort, ठीक है. But over here आपको again figure out करना है, you have to figure out what is the exposure and what is the outcome. So exposure of course is addiction, and outcome that we are looking it as divorced and non-divorced, and it's very clearly written there are two groups of study subjects, divorced and non-divorced. So what are we comparing, guys? We are comparing divorced, non-divorced, and we are questioning, or we are just taking history of whether they used alcohol, drug in both the groups or not. Clear? So what is this? This again is a case control. Also divorce is a rare thing. ठीक है. So I'm trying to show you all the possible questions, guys, how to understand, figure out exposure and outcome. उसके बाद देखो comparison group क्या है. Ever the comparison group is diseased, non-diseased, case control. अगर comparison group exposed, non-exposed है, it is always a cohort. ठीक है. Let's see another question. Can you tell me the answer to this? Parth, I will take you to retrospective cohort question. Don't worry dear, I'll take you to retrospective. वहाँ पे you are comparing outcomes. ठीक है Parth? Divorce, non-divorce, and you're looking at history of exposure. History of exposure, and we all know that effect to cause is case control. You already have the effect, the divorce status. You are asking about the cause, which is the addiction. Got it, Parth? Now over here we have a case control study design. So what are the best groups to be selected? All you need to figure out is what is the exposure, what is the outcome. Food online, this is the exposure. And what is the outcome over here, guys? Outcome is obesity. ठीक है. Now what is the best study groups to be selected if I want to study the relationship of food online and development of obesity using a case control study? So I need cases, so they are what? Obese. I need controls, they are what? Non-obese. I am going to ask them about the online food order. ठीक है. I will ask them about online food order. So this is obese and non-obese. Now some of you have written online food eaters and non-online food eaters. Guys, अगर तुम ये compare कर देते हो, just listen to me once. If you end up comparing, if you start your study with food eaters and non-online food eaters, that is exposure. That is a risk factor. And if you compare exposed, non-exposed, that's a cohort. It was asked case control. All you needed to do was figure out your cases and controls. Of course, your case cannot be food online. Your cases are obese and your controls are non-obese. समझ में आया? अगर तुम इसको compare कर दोगे, this will become a cohort. That's what somebody has written. So don't get confused. A lot of questions coming up, don't worry. Most feasible design to assess relationship between breast cancer and risk factor of OCP uses. What is your answer here? Here there's a buzzword. Feasible. Feasible means can easily be done. Okay? Can easily be done. जो आसानी से हो जाए. अब again, सोचो guys, before you mark your answers, you will have to think. Cancer is a rare outcome. Obviously, breast cancer is the most common cancer, है ना? But it's still a cancer. India is world cancer capital. Agreed to everything, but it's still a cancer. If I go and survey the community outside of my where I put in, maybe I might not find a single cases in the next couple of houses. Are you understanding? Rare चीज़ के लिए सबसे अच्छा क्या है? और feasible मतलब something that could easily be done. I will start with women who have breast cancer, compare them to women who have no breast cancer, and I will just take the history of whether they used OCPUs, no OCPUs. दोनों ग्रुप में मैं क्या देखूंगी? OCPUs, no OCPUs. तो ये कौन सी स्टडी डिजाइन है? केस कंट्रोल. सोचो, I have given you a lot of options everybody. First of all, always figure out exposure and outcome. Identify risk factor क्या है, outcome क्या है. Think, rare disease है, मैम ने बोला है, rare disease के लिए what is the best thing to do? Start with the disease itself. Why wait for years and years for disease to occur? Case control, you will always compare cases and controls, diseased and non-diseased. For cohort, you will always compare risk factor, no risk factor. ठीक है? चलो. Yes. Let's go to the next one. Which of the following is true for case control study design? क्योंकि डिस्क्रिप्टिव सरन नहीं, बिकॉज डिस्क्रिप्टिव रिलेशनशिप नहीं बता सकता. डिस्क्रिप्टिव कैन नॉट टेल अस अबाउट एसोसिएशन. डिस्क्रिप्टिव विल जस्ट डिस्क्राइब अ पॉपुलेशन. द वर्ड हियर वाज क्लियरली रिटन असेस द रिलेशनशिप, असेस द एसोसिएशन. सो यू नीड स्टडी डिजाइन्स व्हिच कैन गिव यू दैट. Okay, Saran, somebody was asking. Which of the following is true for case control? Proceeds from cause to effect? Cause to effect कौन सी study design है? Cause to effect. Risk factor to outcome. What is it? This is cohort. Case control proceeds from effect to cause. Effect हो चुका है. Effect to cause. Just a quick revision. Requires more sample size? No, the good thing about case control is we require smaller sample size. You can kind of work with even minimum 30 cases. You can also work with minimum 30 cases. Suitable for rare diseases? Of course. Estimates, examines exposed versus non-exposed? No. If I ever compare exposed versus non-exposed, it is cohort. कभी मत भूलना. Risk factor versus no risk factor is cohort. Whether it's prospective or retrospective cohort doesn't matter. Risk factor versus no risk factor is cohort. ठीक है? Diseased versus non-diseased is case control. We'll see a lot of questions again. Now, a case control study on vitamin C and respiratory illness follows with sequence. So just wanted to revise steps of case control and cohort. We will do it. Can anybody tell me? Yeah, we've come to that, Dheeraj. I think your question is next, Dheeraj. Steps of case control बताओ. मैं आपको steps of case control, steps of cohort दोनों revise कराऊंगी. What is your answer here? अजय का आंसर आया. Dr. Carl, Shalu, Gaurav, everybody is answering. Guys, सबसे पहले क्या करना चाहते हो? The first thing that you have to do, of course, you have to select your cases and controls. What is the next thing? You will match them. Matching means your cases and controls have to be similar to eliminate confounders. Like I said, if your cases are diseased, your cases are lower class people, your controls are lower class people. Then you will go back and ask them, interview them about their exposure status. Finally, you will do an analysis. So what is this? Option A. Now, can anyone tell me what is the measure or strength of association in a case control study called as? How do you do the analysis in a case control study? What is it that you calculate? Put in the comment section. What is it that you calculate for analysis in a case control study design? Strength of association in a case control is measured by, very good, इसका numerical भी आएगा आज. Strength of association case control में हम लोग किससे करते हैं guys? OR, odds ratio. What is the other name for odds ratio? Cross product ratio. The other name is cross product ratio. What was the formula for odds ratio? I'll give you a numerical, don't worry. The order of ABCD is a Z, ABCD, it is AD upon BC. ठीक है, न्यूमेरिकल्स करेंगे. OR more than one, risk factor or positive association, risk factor or positive association. OR equal to 1, high chance of coming out, no association. OR equal to 1, no association. OR less than 1 मतलब क्या होता है? Protective factor or negative or inverse association. Protective factor or negative or inverse association. Clear? Chalo, let's go to the next question, guys. This we've already discussed, so I'm moving ahead. Steps of cohort भी देख लो. अच्छा, एक और चीज, matching. Tell me something about matching. Matching eliminates which confounders? Matching eliminates only the known confounders. Matching eliminates only the known confounders. This again you have to remember. Matching eliminates only the known confounders. These are steps of a cohort study, can come in your exam. In this, you will select your study subject, ask them, जैसे study subject ले लिया, पूछो exposed, non-exposed, ठीक है. Your buzzword over here is this one, follow up, ठीक है. Your buzzword is follow up, and then of course we have to calculate relative risk, attributable risk, population attributable risk. We will do MCQs for all of that. Okay, try this one. Read it yourself, take 1 minute, answer. क्या है आंसर? Ajay, think what is being asked. Don't be in a rush. Figure out risk factor and outcome. सबसे पहले मुझे बताओ. I'm not interested in the answer. Tell me the risk factor and tell me the outcome over here. What's the risk factor or the exposure and what's the outcome over here? बताओ पहले. 500 women, look at the sample size. Bigger sample size is a hint to a cohort, guys. Bigger sample size, usually a hint to a cohort. कभी भी ना case control में I can't have 500 cases. It's very difficult, okay? So bigger sample size is a hint of a cohort. Now you have to figure out your exposure and outcome. So your meat consumption is your risk factor. ठीक है, and outcome is your cancer. This is your outcome. Now 500 women have come to me for routine checkup. I'm asking them about meat consumption. I'm asking them about their exposure status. कौन सी स्टडी डिजाइन में एक्सपोजर स्टेटस ली जाती है? कोहॉर्ट में. नाउ यू हैव टू फिगर आउट, इज इट मूविंग, इज इट प्रोस्पेक्टिव और इज इट रेट्रोस्पेक्टिव. सो आई हैव आस्क्ड देम अबाउट एंड डिवाइडेड देम इनटू वेजीज, नॉन वेजीज, एंड देयर वाज अ वेरी इंपॉर्टेंट वर्ड ओवर हियर, ensuing 5 years. Ensuing 5 years मतलब next 5 years. That means we are moving forward with time to see how many develop cancer, how many no cancer. So what is this an example of, guys? This is an example of a proper, a beautiful example of a cohort study. कोहॉर्ट में भी कौन सी है? प्रोस्पेक्टिव या रेट्रोस्पेक्टिव कोहॉर्ट? दिस वी आर मूविंग फॉरवर्ड विथ टाइम. सो दिस इज अ क्लासिकल एग्जाम्पल ऑफ अ prospective cohort. Prospective cohort is also called as a longitudinal cohort. ठीक है, these are the two words that you will remember. Prospective cohort is also called as a longitudinal cohort. Let me give you one more question for practice. समझ में आया? Exposure देखो, outcome देखो. Look for buzzwords. Look for comparison group. If you are comparing exposed, non-exposed, it will always be cohort, and you are moving forward. So it is prospective cohort. ठीक है? चलो, let's go to the next one, guys. If you're not getting any question, please note it down. Let me finish. I will tell you and explain you again. ठीक है? Yes. अभी bias पे आएंगे कल आगे. Retrospective cohort में very minimal recall bias. Otherwise, recall bias is a feature of case control study. Now, why am I getting mixed answers here? A, B, B, B. सोचो again. Study to determine association between maternal smoking histories from pregnant women during the antenatal visits and then subsequently assessing. Subsequently. Now, don't get confused by the word history over here. That history word आ गया, so चलो backwards. नहीं, it was not a question for that. The women have come to you during ANC visits. And you are taking their smoking histories. You are asking them. It's like a personal history taking. Do you smoke? Have you ever smoked? Okay. So what am I doing? I am comparing smokers, non-smokers. I deliberately brought this question, guys, so that you don't get confused. History matlab backwards. But yahan we are not going backwards. The women have come to me during their ANC visits and I'm asking them about their lifestyle, which is one of the factors is smoking. Are you a smoker? Have you ever been a smoker? So I'm comparing what? Exposed, non-exposed. So what is it? A cohort. Okay, and then I'm subsequently assessing the birth weight of the babies. Subsequently assessing means I'm going to go forward with time, and I am going to see kitne bacche low birth weight, no low birth weight. After 9 months, how many low birth weight, no low birth weight. So which type of cohort is it? It is a prospective cohort. संगीता, रेट्रोस्पेक्टिव कैसे होगा? रेट्रोस्पेक्टिव कोहॉर्ट में क्या होता है ना, यू गो बैक, यू टेक आउट ओल्ड डेटाज एंड कंपेयर. Here it is clearly mentioned the women have come to you during ANC visits. You have divided them on the basis of their smoking histories and you're moving forward in time to assess the birth weight. ठीक है? Okay? चलो. So एक word देखा subsequently. Okay? Let's go to the next question. Now think about this. A study was conducted on a group of 600 patients with breast cancer and another group of 300 people chosen from the general population. Both groups were questioned about their exposure to smoking. Think, study किस direction में proceed हो रहा है? Which direction is the study proceeding? Is it going from effect to cause or cause to effect? Guys, think carefully. Think carefully. What is your comparison group over here? What is your comparison group? Good. What is your comparison group? ठीक है? And so many people from general population. So it was very, very, very clearly written. You have two groups over here. 600 patients with breast cancer and so many people from general population. Both were questioned about their exposure. So what are you having? You already have a population. You already, what is your comparison group over here? You have a comparison group of breast cancer women, breast cancer, no breast cancer. This, you had a population, you have divided them into diseased, non-diseased. What is your comparison group? Diseased, non-diseased. Which study is diseased, non-diseased? Case control. Clearly बोल रहा है breast cancer, rare disease. And look, both the groups were questioned about their exposure. I told you, you can only question people. ठीक है? So that is possible in a case control. So I have questioned them about smoker, non-smoker. I questioned them. I am conducting interviews. Smoker, non-smoker. So what is this? This is a clear-cut case of case control. वो exception हो सकता है प्रतीक्षा. This could be a exception. Don't be very hell-bent on the sample size. What was more important here? Very good question Pratiksha has raised that, ma'am, look at the sample size. Of course, I agree with her that in this question, the sample size is more. So it could be cohort. But then, dear Pratiksha, what is more important here? To look at the rest of the things, which is comparison group. What is your comparison group? Women with breast cancer and from general population without breast cancer. So you were comparing diseased, non-diseased. It is case control. And you are taking interviews. I told you, if you take interviews, what does that study design become? Case control. Abhi dekhna, why is it not retrospective cohort? Okay, I will tell you that also. Is it clear, everybody? Why not B? Because you have two groups. ठीक है, बी में क्रॉस सेक्शनल में आई डोंट डिवाइड देम इनटू टू ग्रुप्स. आई हैव अ सिंगल ग्रुप इन विच आई गिव आउट अ क्वेश्चनर. ठीक है, हियर यू हैव अ ग्रुप विच इज डिवाइडेड इनटू ब्रेस्ट कैंसर एंड नो ब्रेस्ट कैंसर. Got it? And cross sectional में you do it at the same point of time. You will not question them about their exposure. The biggest reason why it's not cross sectional, because we don't divide into groups. We have a single group. ठीक है? All right. Now look at this one. Tell me the answer to this. Tell me the answer to this. I will sum up the buzzwords for you at the end. Just try one or two questions more, then I will sum up the buzzword. अब ध्यान से इसको करो. And anybody who has a doubt, please ask me towards the end. Okay, it will become easy for me to make you understand also in case you don't get it. Chalo, what is the answer to this one? Socho, look at the buzzword. 12 women with endometrial cancer and 12 women with no disease were contacted and asked whether they had ever used estrogen. each woman with cancer was matched by age, race, weight and parity to a woman without disease. अब कोई mistake नहीं होना चाहिए. What is the answer over here? Very good. What is the answer over here? Case control. Why is it case control? All those who could not understand it. क्यों है ये case control? Cancer, a rare thing, a rare disease. What is your comparison group? 12 women with cancer and 12 women with no apparent disease. So you have cancer and no cancer. Outcome is cancer. And you are asking whether they used estrogen. So you are interviewing, you are questionnaire. आप questionnaire, आप interview कर रहे हो. If you actually ask the people, it is what? It is a case control study design. Plus you are asking them about, ठीक है, estrogen, no estrogen, ठीक है, estrogen, no estrogen. You are asking them estrogen, no estrogen. Also the biggest word, matching. What is the answer over here? Case control. Is it clear? Did you understand? Everybody समझ में आया? What were the comparison groups? All those who did not understand previously, clear cut. Comparison group देखो, diseased to non-diseased, case control. You're going back and you're asking them and asked whether they had ever used estrogen. So you're not looking at records, you're actually interviewing, you're actually questioning. You can interview and question people. So it is what? A case control study design. Plus यहाँ पे buzzword क्या था? Matching. Got it? चलो, let's now give you another question. अब थोड़ा सा दिमाग लगाना है. Think. Always remember my words. Ma'am had said to figure out exposure outcome. Ma'am had asked to look at the ears. Ma'am had asked to check out the comparison groups. Ma'am had asked to look for the buzzwords. Is it interviews? Is it past records? What is it over here? Take your time. Take your time. You can extend the class 10 minutes. No problem. गलत नहीं करना है. Now, ध्यान से पढ़ो. Physical examination records of the entire incoming freshman class of 1935 at University of Minnesota. When were you examining them? In 1977. So you have the records of 1935. When are you examining? At 1977. To see if the recorded height and weight at the time of admission to the university was related to the chance of developing CHD. अब ये कितना प्यारा सवाल है. This is like a beautiful question which will clear all your doubts. Now see, the first thing that you have to again figure out is risk factor क्या है and outcome क्या है. ठीक है, risk factor क्या है and outcome क्या है. What is the risk factors that we are looking over here? We are looking at the height and weight. These are the risk factors, or you could say the exposure details. ठीक है, and developing CHD, this is your outcome. Okay, next you have to look at the years. Okay, the question says that I am examining in 1977. What am I examining in 1977? I have gone back and used records. So the buzzword over here, past records of a group which was admitted in a college in 1935. So I have gone back, used that old records, and I am comparing, let's say, weight on the basis of weight, obese, non-obese, something like that, and I am looking at the chance of developing CHD at the present time. So what is this? This is a retrospective cohort. A very big word over here was records. Case control में तुम records क्यों देखोगे? केस कंट्रोल में तो तुम इंसान को इंटरव्यू करोगे. डिड यू अंडरस्टैंड व्हाट डिड आई जस्ट से? इन केस कंट्रोल, व्हाई वुड आई लुक एट रिकॉर्ड्स? आई विल बी इंटरव्यूइंग द पीपल बिकॉज आई हैव केसेस एंड आई हैव कंट्रोल्स विद मी. बट इन रेट्रोस्पेक्टिव कोहॉर्ट आई डोंट हैव द पीपल राइट नाउ. आई एम नॉट स्टार्टिंग विद द पीपल. आई एम यूजिंग द ओल्ड रिकॉर्ड्स. On the basis of that, I divide them into exposure, non-exposure, and look at the outcome at the time the study begins. So what was this? This was retrospective cohort. Don't think that we started in 1935 and I have moved to 1977. No, it was clearly written that records of the entire incoming freshman class of 1935 are being examined in 1977. So we are in 1977, we are examining records of 1935. So we've gone back, used past records of 1935 to look at the outcome in the present time. Is it clear everybody? ठीक है, चलो. So what is this? This is your retrospective cohort. Remember, again, big bold letters में I will tell you one more time. Big bold letters. Case and control. Start. Diseased, non-diseased. Questionnaire. Okay, questionnaire. Interview. Alright. But for a retrospective cohort, what do you go? You will go back, compare exposed to non-exposed, exposed to non-exposed, okay? And your buzzword would be, I am using past records, old data. Whenever you compare exposed, non-exposed, it is cohort. Now, if you move forward with time, it is prospective cohort. But if you move backwards with time, it is retrospective cohort. Clear everybody? ठीक है. अब चलो जो question आया था, let's have a look at this. Yes, concurrent cohort is the same as prospective cohort, okay? And retrospective cohort, concurrent cohort is the same as prospective cohort, ठीक है? Retrospective cohort you can also call as non-concurrent cohort. I will sum up the buzzwords at the end. Absolutely nothing to worry. चलो, now देखो question क्या आया था. Everybody, don't be in a rush. Even if you have seen this question, just do it. Try to take up the approach. You have to identify the exposure and outcome. You have to look at the comparison groups. You have to look at the buzzwords. You have to see whether there are rare diseases. You have to see whether there are rare exposures and accordingly answer. देखो ये रट्टा नहीं मारना है. रट्टा तो नहीं मारा आपने, रटना मत, बिकॉज सेम क्वेश्चन आएंगे, गारंटी नहीं होता ना. टॉपिक आएगा रेट्रोस्पेक्टिव कोहॉर्ट. सो अगेन, what is your exposure over here? Risk factor, aniline dye, ठीक है. And bladder cancer is the outcome. Bladder cancer is the outcome. Participants have been divided into two groups. Look, one handling dyes, that means one which is exposed, and office clerks with no direct exposure. So this is what? Non-exposed. And you can see we are taking records. Again, we are starting, but we are going backwards. Based on that, we have dye, no dyes, ठीक है, and we are looking at the present time to bladder cancer. So this was your buzzword कि ठीक है, records मतलब more chance of retrospective cohort over here, and your comparison group was also dyes. That means risk factor, no risk factor. So it is retrospective cohort. ठीक है. नहीं प्रतीक्षा, अगर इंटरव्यू होता तो क्वेश्चन क्या होता? वी आर स्टार्टिंग विथ पीपल हु हैव ब्लैडर कैंसर एंड कंपेयरिंग देम टू दोज हु हैव नो ब्लैडर कैंसर. इफ द क्वेश्चन वाज वी स्टार्ट विद I have people who have bladder cancer, I am comparing to them who have no bladder cancer and conducting interviews regarding dye exposure, that would have been case control. Here my comparison group clearly mentioned है dye handlers exposed, no direct exposure मतलब clerks, ठीक है. The data I am picking up from the past records. Clear? Okay. Now look over here. Everybody, this one, the same image. You start the study over here. You go back, past records use करके what are we doing? Tire makers. Instead of this, dye handlers हो सकते हैं, clerical staff. So you're comparing exposed, non-exposed, and you're looking at this. This is what? Retrospective cohort. This is what? Retrospective cohort. ठीक है. Again, केस कंट्रोल यू स्टार्ट विथ विक्रम. केस कंट्रोल में तुम केसेस से स्टार्ट करोगे बच्चे. यू विल स्टार्ट विथ कैंसर, नो कैंसर. यू विल गो बैक एंड इंटरव्यू देम रिगार्डिंग डाई, नो डाई. But in retrospective cohort, you will go back, you will use some past records, buzzword to divide into tire makers, और exposed non exposed. आप retrospective cohort में हमेशा you will compare exposed and non exposed. Is it clear everybody? Rijita, did you understand? Here the group that we had, it was clearly written two groups, one handling dyes, that means one exposed, antlers not handling dyes, that means they are non exposed. Okay, now anyone who didn't get it, you can tell me, I will take it up again. Identify the study design. Give me the name quickly. We're running little short of time, guys. We have to do numericals also, so let's buck up a little. बहुत कम होता है recall bias, hardly होता है, ठीक है? What is the answer to this one over here? Now you can see, start the study. What is your comparison? Obese, lean is your, obesity is your risk factor, no risk factor. और हम लोग follow up means we're going forward in time. So this is which one, guys? This is prospective cohort. Cohort में always remember, whenever you compare, देखो guys, last time एक बार और एक चीज़ बताती हूँ, ठीक है? Exposed versus non-exposed. You have to be able to figure out this. Risk factor versus no risk factor. Whenever you see this comparison, it is cohort. ठीक है? Now, if you see words like with time, okay, parallel time के साथ move कर रहे हो, prospective cohort. Okay, I have taken the exposure detail and moving forward. If you see past records, you are moving time के against time जा रहे हो, ठीक है? This is your retrospective cohort. This is all you need to do. What you have to figure out, what are you comparing? Exposed, non-exposed. And if you are comparing diseased, non-diseased, diseased versus non-diseased, and you are interviewing, questionnaire, exposure details, ये क्या होता है तुम्हारा case control. ठीक है? Everybody, चलो. Now, any other question, just keep it towards the end. Let me sum up the other topics also, guys. We have a couple of more things to see. Quickly answer karo isko. Last में, I'm going to give a slide of all the buzzwords together. Okay? Which of the following is not a characteristic cohort? Results are quicker? No. Results take time. Proceeds from cause to effect? Yes. Suitable for rare exposure, abhi pada aapne, you just studied the dye exposure and that one. So like rare exposure over here means the occupational exposure, and of course we know we can calculate all these things. So results are quicker. Bias abhi dekhenge, don't worry. What is the answer to this? A cohort study on green tea and diabetes found a risk ratio of 0.84. What does this suggest? Which answer are you writing? We've moved to the next question now. Yeah. Okay, bolo iska answer bolo. Yes, 0.8. Now risk ratio is the other word for relative risk. We'll go to the numericals, don't worry. Relative risk, what is the formula for relative risk? We look for incidence among exposed divided by इंसिडेंस. अभी न्यूमेरिकल प्रैक्टिस करेंगे, उसमें देखेंगे इंसिडेंस अमंग नॉन एक्सपोज्ड, ठीक है? Yes, rare disease for case control. So this is, you can get relative risk more than one. So if you get relative risk more than one, it is a risk factor. If you get it equal to one, it means no association. And if you get it less than one, it means what? It means protective factor. So here I got 0.84. Remember, risk ratio is the same as relative risk. That means green tea क्या करता है? Reduces the risk of diabetes. Okay. All right. Next one. Take your time. Let's see how many of you can do this. Another way the question could come. This has never come. The question that I've given you, it's not from any exam, but I'm just trying to show you one another way the same topic could be asked. Instead of asking you directly, it's another way they could ask you. Padho, and you can do it. It's not at all difficult. Socho. Think na. Don't be in a rush. Think, everybody. While investigating a point source epidemic, it was found that 120 students ate 5 different foods. burgers, fish, steak, fruit salad and rice. The relative risk was calculated and found that fish was not responsible for the epidemic. So fish is not responsible. So that means what is relative risk of fish? Fish is what? Fish is a protective factor. Fish is a, alright, it's not responsible. So what is it going to be? Very good. The answer to this is 0.7. Relative risk is going to be less than 1. ठीक है, मैं यहाँ देख लूँगी. Alright, everybody, did you understand? Fish was not responsible for the epidemic. If you eat fish, you're at 1.2 times at risk. So more than ये होता, these are all more than factors. So 0.7, it's not exactly protective also. So the most suited answer here was option A, 0.7. Is it clear? It was written that the fish was not responsible for that. That means fish is not a risk factor. So it would either be equal to 1 or it would be less than 1. It could not be more than 1. So these were not the answers. Less than 1 में एक ही आंसर था 0.7. It could also be equal to 1. हो सकता है no association, हो सकता है less than 1. But over here it was written that fish was not responsible. If it was responsible, then the value would have been more than 1. Clear? अगर if it was responsible, then it would have been more than 1. Any doubts in this one? Everybody got it? ठीक है ना? Question उल्टा frame कर दिया. It was just framed opposite. That fish is not responsible. That means fish is not a risk factor. So when is it not a risk factor? When it is less than 1, or maybe it has no association, equal to 1, but it can definitely not be more than 1. ठीक है? Okay, moving to the next one. Let's see if you can do this. Take your time. Do this one, guys. So I think we'll be taking the class for another 20-25 minutes, okay? Because we have numericals also. Chalo. While launching a new national health program and policy, PAR is calculated. PAR, Fmge and neetpg में थोड़ा कम chance होता है. Little less chance for PAR to come in neetpg, Fmge. More important for NICT. So, but still, we can just look at its definition. What is the first one? Incidence of disease among exposed is so many times higher as compared to that of non-exposed. Alright, what is the first one? If you look at incidence of disease among exposed is so many times higher than non-exposed. ये क्या है? This is relative risk. ठीक है? So much disease can be attributed to an exposure, attributable risk. If a risk factor is modified or eliminated, there will be so much annual reduction in incidence of the disease in the population. If you use the word population, it is population attributable risk. Because what was the formula of PAR, guys? Incidence. I will discuss all the formulas once we take up the numericals. We are just going to go to the numericals in a while. Incidence among total population minus incidence non-exposed, okay, divided by incidence in the total population. और always इसको multiply हमेशा करना 100 से. Total population में कौन आता है? Total population is going to include exposed and non-exposed. Okay, it will include exposed as well as it will include non-exposed. ठीक है? Another question, if you have any doubt, keep it with you. Let's see if you can do this one. Okay, what is the answer to this one, everybody? If the attributable risk, guys, see, there are 3 things that we calculate in a cohort. I will explain to you. पहले इसका आंसर करो. What do you mean by this? Think and answer. Attributable risk बोला है. Attributable risk. Attributable risk कभी भी population में नहीं होता है. If it is in the population, this is what? PAR. Attributable risk क्या होता है? 90% cases of lung cancer can be eliminated in smokers because that is exposed group. Okay, let me explain you. Some of you might get confused. देखो, just give me one moment, okay? Whenever you have a question, guys, disease comes to the column side, yes, no. All right, smoking, let's say exposure or let's say risk factor. ठीक है, let's say risk factor. Yes, no, comes on the row side. Your order is A, B, C, D. It's a Z. This is a smoker. This is a non-smoker. I'll give you the buzzword here also. ठीक है, what is relative risk everybody? Formula of relative risk क्या होता है? You all know it is incidence exposed upon incidence non-exposed. ठीक है, incidence non-exposed. What is attributable risk, guys? What is attributable risk? What is attributable risk? How much of a disease is attributed to a particular exposure? How much of a disease is due to a particular exposure? So it is incidence exposed minus incidence non-exposed, okay, divided by incidence exposed. So attributable risk, you only look in the exposed group. But what is population attributable risk? It is incidence total population. टोटल पॉपुलेशन में एक्सपोज्ड भी आएगा, नॉन एक्सपोज्ड भी आएगा. खुद सोचो, टोटल पॉपुलेशन विल हैव एक्सपोज्ड ऑल्सो, नॉन एक्सपोज्ड ऑल्सो, माइनस इंसिडेंस नॉन एक्सपोज्ड डिवाइडेड बाय इंसिडेंस टोटल पॉपुलेशन. Clear? Buzzword for attributable risk only in the exposed group. But population attributable risk, the buzzword is population, both exposed and non-exposed. Now go back to this question. The question asked attributable risk. So किसमें देखना है? 90% of cases of lung cancer can be eliminated in population. No. If I say population, it is PAR. If I say exposed group only in smokers, then it is your attributable risk. क्योंकि एग्जाम बहुत नियर है गाइज, वी कांट गो इनटू टू मच ऑफ डिटेल. द बज़वर्ड यू आर गोइंग टू रिमेंबर if the question, that's why I'm giving you all the different types of questions that could come. After the class finishes, just go through once these questions and you will be so good in Epid, okay? If the buzzword comes smokers, exposed group, it is attributable. If they say population attributable, जैसे यहाँ पे था, ठीक है, in the population, what is your answer? Population attributable risk. Clear? कभी हड़बड़ी में आंसर मत करना, अभी न्यूमेरिकल्स भी आएंगे तो हो जाएगा. चलो अब इसका आंसर बताओ. Don't make a mistake. This is a NEET-PG PYQ. Don't be in a rush. Look at this. Look at this word. Difference between incidence in exposed and non-exposed group. I just gave you the definition. Difference between incidence in exposed and non-exposed group, guys. What is your answer over here? So happy. Good. Good. Let me tell you what happens in exams. Okay, the moment you get this question in exams, how will your mind work? At times it happens. You will see incidence in exposed and non-exposed. You can end up marking relative risk, but it is not relative risk. It is difference. And we just did the formula of attributable risk. What was the formula of attributable risk? It is not a difference. It is not a ratio kind of. It is incidence. It's difference. Incidence exposed minus incidence non-exposed divided by incidence exposed. Glad everybody was able to do it. चले आगे. Okay, चलो. थोड़ा सा और time we're going to take, guys. All are true regarding confounding factors except. So let's discuss confounding and biases, then do the numericals. All are true regarding. Yes, very good. Indian and China. RR is not a difference. RR is a ratio, bacha. Relative risk is risk ratio. Incidence exposed by incidence non-exposed. इसका आंसर बताओ. All are true regarding confounding factors. It is associated with exposure under investigation. It is associated both with exposure and disease. It is related to matching in case control. This is the exact PYQ. Is it distributed equally? No. It is distributed unequally. It is distributed unequally. That is why it's a confounder. Like suppose I was studying smoke and hypertension. So my exposure is smoking, my outcome is hypertension. Alcohol could be a confounder. Why? Because this third variable is also associated with exposure. जो लोग, people who smoke, most of them drink also, and even if I don't smoke, I just drink. Drinking has independent association with hypertension. If you don't smoke, you only drink, you can still go on to develop hypertension. And we all know matching case control, it eliminates only the known confounder. Eliminates only the known confounder. Okay? Let's see this one. Think about it and answer. Guys, if you're not able to wrap up in one or two topics, just say कुछ अगर बच जाएगा, I'll take it up tomorrow. Okay? Exercise effect modifier, वो वाला question जो आप कह रहे हो, Dipanshu, Dr. Dipanshu. What's the answer to this? A researcher, again, case control. Association between dietary habit and risk of rare cancer. ठीक है? So what is my exposure over here? Dietary habit. What is my outcome over here? Cancer. Researcher is concerned about potential confounding due to smokers and age. These are smoker and age. Now case control mein, what is the best thing that we do? Matching. Simple question. Just to revise the techniques. Bestest method to eliminate confounders, guys. Bestest method to eliminate confounders. Alright. Bestest method confounder को eliminate करने के लिए होता है regression models. ठीक है, regression. But second best method is randomization. Second best method is randomization. Bestest is regression models, which they shouldn't ask you. Second best is randomization. Randomization, maybe it is stratified randomization. Stratified randomization. Because it eliminates what? It eliminates both known and unknown confounders. Both known and unknown confounders. Because your exam is very near, what you should remember, matching eliminates the known confounders. Randomization eliminates known as well as unknown confounders. What are the definitions of all these techniques can eliminate confounders? Okay? And what is a confounder? That also you should remember. Now tell me something. Most appropriate matching नहीं है. यहाँ पे answer matching क्यों था? Because case control है ना, Dr. Pratiksha. Since we're doing case control, we can match cases and controls. That is why the answer was in a case control. What will you do? So we do matching. ठीक है? चलो, let's go to the next one. Blinding. ब्लाइंडिंग क्या एलिमिनेट करता है? फटाफट से बताओ. ब्लाइंडिंग क्या एलिमिनेट करता है? व्हाट डज ब्लाइंडिंग एलिमिनेट्स? व्हाट डज ब्लाइंडिंग एलिमिनेट्स? फर्स्ट हमेशा रिग्रेशन है. रिग्रेशन इज द बेस्ट मेथड टू एलिमिनेट कंफाउंडर्स. देन स्ट्रैटिफाइड रैंडमाइजेशन. देन रैंडमाइजेशन. मैचिंग कैन ओनली एलिमिनेट नोन कंफाउंडर्स. Randomization can eliminate known as well as unknown. Very good. Blinding will eliminate bias. So tell me, which is not a cause of bias in case control study design? Bias के साथ you all have to remember these are systematic errors. They don't happen by chance. We conduct bias during the design of the study, during analysis. ठीक है, हम लोग by chance ये errors नहीं हो रहे. We are making these errors. So what is your answer over here? Very good. Hawthorne bias. Hawthorne bias is seen in a cohort study. What was Hawthorne bias? Subjects modify their behavior on being observed. If I was a smoker, I will quit smoking in between. ठीक है? Recall bias, selection bias, interviewer bias, all are favorite biases of a case control study design. Answer to this one, hospital admission rates differ across hospitals for different diseases. This causes which type of bias? हाँ, बस नाम याद रखना था. Bergsonian bias. Bergsonian bias is a type of selection bias, guys. It's a type of selection bias which occurs due to different hospital admission rate. Cohort में you will remember the two biases, attrition bias also in cohort and Hawthorne bias. Loss to follow up and Hawthorne bias. ठीक है, they are seen in cohort. Case control, you have recall bias, you have interviewer bias, you have selection bias. A type of selection bias is Bergsonian bias, which is a hospital admission bias. And bias को किससे eliminate करते हो? Bias eliminated by B for B, blinding. I hope you remember blinding, guys. Single blinding means subject is unaware. Double blinding means subject and investigator are unaware. And triple blinding means subject, investigator, analyzer are unaware. But because आजकल investigator ही analysis कर देता है, so most common blinding is double. Most common form of blinding. Most common is double blinding. But best is which form of blinding? The best is triple blinding. Okay? Chalo. Answer? Okay, a study was done in 3 states. Now let's see the difference between cross-sectional and ecological study also. A study was done in 3 states to determine the mean blood pressure in each community. Health workers were assigned to visit each community, each house in the 3 communities. Mean blood pressure in each community was calculated and compared. ये कौन सा study design है? अब देखो guys, 3 states. That means you have 3 different groups. In a case control and a cohort, what happens? You have one group. If it's a case control, you have one group, you divide into cases and controls. In a cohort, what happens? You have one group, you divide into exposed, non-exposed. But here you have 3 states where I have to see the mean blood pressure in each country, each community. I am sending team 1 over here. I am sending team 2 over here. I am sending team 3 over here. So what am I going to do? I am going to compare the blood pressure at the same time. In each community is calculated and compared, the mean blood pressure. So it's being done in 3 different states. The teams are going. This is an example of cross-sectional study design. You might ask me, ma'am, why is it not field trial? Field trials vaccine trials होता है. Blood pressure कोई trial नहीं है, ठीक है? It's just a measurement. Why is it not cohort and case control? Because in cohort, the same group has to be divided into exposed, non-exposed. You can't compare 3 different groups. Here you are comparing 3 different groups. Is it clear? Now can anyone tell me which statistical test will you use over here? Your options are paired t-test, unpaired t-test, chi-square, ANOVA. कौन सा statistical test यहाँ पे use करोगे? Paired t-test, unpaired t-test, chi-square test, ANOVA. कौन सा statistical test use होगा यहाँ पे guys? I've come up with one answer. Yashveen, Suvarna, very good guys. 3 different groups. Mean blood pressure. Blood pressure is a quantitative variable. When you have a quantitative variable, because it can be measured, it has a unit. So, and you have more than 2 groups, which one will you use? Very good. You will use ANOVA. This I will discuss in this thing, biostats. But अभी ऐसे सुन लो. Quantitative variables मतलब 3 group. Quantity भी आएगा. Yes. So, it is ANOVA. Very good. Chalo, tell me the answer to this. A community medicine intern is tasked with study the burden of diabetes in a community. So if you have to study the burden of a disease in a community with study design, let me make you practice numericals also. Burden of diabetes in a community to establish screening and treatment services. कौन सी study करना चाहोगे? Buzzword, burden. What do you mean by burden, everybody? I just wanted you to know this. Burden means prevalence. If I have to go look for prevalence of a disease in a community, I will be calculating the burden. And burden is calculated from which study design, everybody? None other than cross-sectional. The buzzword for this burden. Burden means we will be looking at the prevalence. Prevalence means what are we going to calculate, everybody? The cross-section. Do cross-sectional study design. Cross-sectional study is done at the same point of time using primary data. Ecological study is done at the same point of time using secondary data. Let me take you to one ecological question first. Okay, look at this question. What is your answer over here? Person wants to study the relationship between smoking and lung cancer. He collects the data from government hospitals on lung cancer cases and compares this with cigarette sales data during the same period. Iska answer kya hai? What is the answer over here? Buzzword for ecological is populations, secondary data. So over here this is ecological. Why? Now at the same point, okay, at the same point of time, we can have two types of studies. We can either have a cross-sectional study, we can either have a ecological study. In cross-sectional, I will rely on which data? Primary data. In ecological, I will rely on what data? Secondary data. Secondary data means previously collected data. So, I am studying relationship between smoking and lung cancer. I am collecting the data from government hospitals. That means this is what? A secondary data. So, which type of study design is it? Ecological. It's not cross-sectional because I am not collecting the data myself. It's not experimental. There's no intervention happening over here. Quasi-experimental क्या होता है? Natural experiment. Quasi-experimental is natural experiment. That means it is interventional study without randomization. Natural disaster से दो लोग automatically get divided into two groups. I did not make the disaster happen. That is quasi-experimental. Alright, chalo now look at this one. No, not this one. First this one. What is the answer to this? Which one is the last question? Okay, do this one, then I will do it. Yes, collecting data oneself by one own self is primary data. Relying on previously collected data, everybody, is secondary data. Socho, there's a very big buzzword over here. There's a very big buzzword. In a UK study, UK क्या है? UK is a country. Country means population, and whenever you study a population, case reference study case control होता है, ठीक है? Case reference study is nothing but case control. Now whenever you have to study a population, a country, which type of study design it is? Ecological. So I've shown you questions, you know, which could mimic or which could come in, like which could resemble questions in your exams. You asked me, ma'am, how to identify ecological. That's how you can identify. Either you will see the unit of studies of population. You will see they have mentioned secondary data, relying on previously collected data. So that from government setups or something, that is ecological. Ab samajh mein aaya everybody? Chalo. One more thing. I will take up this. Okay, let's see this one. Okay, I will try Zoya, but for UPSC CMS, you can also keep attending these sessions, okay? Alright, in a disease with 100% mortality, relationship between incidence and prevalence will be? Cha. Socho guys, P is equal to I into D. Prevalence is equal to incidence into duration. Okay? A disease is 100% mortal. That means the moment a person suffers from the disease, the person will die. So D will decrease. No doubt in that. P will decrease. But the rate at which new cases will occur, वो तो same रहेंगे ना. The rate, suppose there is a XYZ disease. Let's say rabies. Rabies is 100% fatal. As soon as a person suffers from rabies, if he is not vaccinated, the person will die. Right? So P will decrease. But dog bites will still happen. You might just walk and trouble a dog, he will bite. So the rate at which new cases occur, the rate at which incidence is by a cohort study. So the rate at which new cases occur, what happens to that? That remains the same. तो क्या हो जाएगा? P, will it be equal to I? No. P will be more than I. P can't be more than I because it's 100% fatal. People are dying. So what is the correct answer? P is less than I. समझ में आया? Everybody. P is equal to I into D. है ना? Now over here what is happening? 100% fatal. People will die. D will decrease. So P will automatically decrease. But the rate at which new cases occur, that remains the same. So what is the correct thing over here? P is less than I. Risk factors तो same रहेगा ना. ART drugs will act on the patient, but the incidence is going to remain the same. People will have unsafe sexual practices. They are injecting drugs. ठीक है? चलो. Do this one. A new immunotherapy drug for metastatic melanoma improves survival. What is the impact on incidence and prevalence? Let's see if you can manage this one. Guys, we'll take 10 more minutes. Medico, try to do this. Dear, P is equal to I into D. This is the equation, relationship of prevalence and incidence. Now, if the disease was 100% fatal, मतलब जिनको वो disease हो रही थी ना, वो तुरंत मर जाते हैं. तो अगर वो तुरंत मर जाएंगे, ये D for duration घट जाएगा. तो prevalence क्या होता है? Existing cases, new and old. तो अगर D घट जाएगा, तो P घट जाएगा. ठीक है, बट जिस रेट पे नए केसेस अकर करेंगे वो तो सेम रहेगा. इंसिडेंस सेम, इसीलिए उसका आंसर क्या था? P is less than I. Now what is happening over here? New immunotherapy drug for metastatic melanoma survival को improve कर रहा है. P is equal to I into D. So people will live longer. They are not getting cured. They are living longer. So what is happening over here? Prevalence increases. But what happens to the incidence? The rate at which new cases will occur, वो तो same रहेगा. Drug will not act on the risk factors. They will only act on the cases. So incidence remains the same and prevalence increases. ठीक है? The rate at which the cancer is occurring, the risk factors पे drug doesn't work. Whenever you get a question like this, you have to see P is equal to I into D. If the duration is decreasing, जैसे 100% fatal या easily curable, P decreases. But a drug is suppose not curing you, but it is making you live longer, तो D बढ़ जाता है, तो P बढ़ जाएगा. अगर तुम क्योर हो जा रहे हो, D घट जा रहा है. But in all the cases, incidence is the same because the drug will not act on the new cases. Am I clear? Everybody remember this equation? That question was asked in your Fmge exams, so you cannot mess it up. Now let me just quickly give you a couple of more questions. Randomization का एक question करो. Major purpose of random assignment in a clinical trial is to randomization मतलब क्या होता है? Random means every participant gets an equal and known chance to go into the new drug group or the placebo group. So it eliminates two things. It eliminates selection bias and known and unknown confounders. Known and unknown confounders दोनों eliminate करता है. What is the purpose of random assignment? It is eliminating selection bias. मेरे मन पे नहीं है that okay you are wearing a red shirt, so I will give you the new drug because I like the red color. Nothing like that. It eliminates selection bias means it ensures. How is it eliminating selection bias? It ensures that the study groups are comparable on baseline characters. Two questions from RCT can come, guys. First one, it means equal and known chance. Every participant, like I will pick up the chit. If I have 50 people, I will put 50 names in 50 chits. I will pick up. So everybody has a chance of coming out. किसी का भी नाम आ सकता है. 1/50th chance. So it eliminates selection bias by ensuring comparability, and it eliminates known and unknown confounders. ठीक है? Chalo, image I'm going to give you another day. What's the answer to this? All are true about RCT except. Why not A? Let me go to that question. Let me finish up. Then I'll take that question again, Pratiksha. Okay. All are true about RCT except baseline characteristics are comparable in both study and control groups. Required sample size for the trial depends on the hypothesis. Dropouts from the trial are excluded from the analysis. Double blinding can eliminate investigator bias. Only for one question I've given you this. Dropouts. There is something which is known in an RCT, guys. What is it? Intention to treat. Intention to treat means dropouts not excluded. Dropouts not excluded. Even if like cohort gets affected by a attrition bias. But यहाँ पे क्या होता है? RCT not affected by attrition bias. Not affected by attrition bias. RCT कभी भी affect नहीं होता by attrition bias, because I can, if people leave my study in between, I can still do an in between analysis. Clear? Baseline characteristics are comparable. Required sample size depends on the trial. Whatever you're doing, just for one thing, that dropouts from the trial are excluded. No. Intention to treat set is not this thing. Okay. Just keep your doubts towards the end. I'm going to take you to numericals. Oh, before that, what is your answer to this? Which quantitative method is best for reviewing previous research studies? New vaccine caravan, very good question. अगर कोई vaccine आता है, let's forget about new vaccine. Talk about measles vaccine. So the baby doesn't have measles right now, but you're vaccinating so that the baby doesn't go on to develop measles. So any protective thing is going to reduce for anything which acts on the risk factor will reduce the incidence. नया vaccine incidence कम करेगा, disease नहीं होने देगा, and if incidence decreases, automatically in due course of time, prevalence will decrease. Got it? Okay. Now, best to study previous research are two things: systematic review and meta-analysis. In systematic review, there is no quantitative analysis. There is no quantitative analysis. But in meta-analysis, you have quantitative analysis. We can't go into too much detail right now, guys. Meta-analysis is analysis of analysis. That means analysis of already analyzed values. I have articles which are published. I'm analyzing all those values. That is why meta-analysis is the gold standard of evidence-based medicine. Gold standard of EBM, evidence-based medicine. To study previous research articles, you can use systematic review, you can use meta-analysis. In systematic review, you don't do any quantitative analysis. In meta-analysis, word ही है, analysis of analysis. तो आप एक quantitative analysis करते हो, ठीक है? Oh, ये तो हमने कर लिया, sorry. Graphical assessment of publication bias is made by anybody who remembers this. Wanted to discuss two images, although images will be taken up on 4th of July. We have an image based session 12 o'clock on Prep Ladder YouTube, not on my YouTube. ठीक है? इसका आंसर क्या है? Publication bias is assessed by funnel plot. Forest plot is only drawn for a meta-analysis. Forest plot, which gives you the effect size. Okay, the pooled estimates. Funnel plot is for publication bias. This was funnel plot, guys. This was funnel plot. Okay, this is checking for publication bias. You draw for both systematic review and meta-analysis. If the dots are scattered, no publication bias. That means I am publishing articles with positive findings as well as negative findings. If I only publish articles with positive findings, it is a bias, publication bias. If I publish articles only with negative findings, it is a publication bias. But when I publish articles both with positive and negative findings, it is funnel plot. और dots अगर scattered है तो bias नहीं होता है. ठीक है? Yes, file drawer effect. Very good. What is this one, guys? This is forest plot. Interpretation, I'll see if I have time, I will tell to you. This is only drawn for a meta-analysis. Interpretation of forest plot we will take up in the image-based session. Okay? Okay, now before we go to the numerical, one last question over here. Then we have 3 numericals on the board. What is the answer to this? Weakest study design. Box and whisker plot alag hota hai, Pratiksha. I'll teach you in biostats, okay? What is this? Yes, of course it is enough. Akhtar, I've tried to cover almost everything in RR, ठीक है? इसका आंसर क्या है? Mixed answers. Remember this. First thing that you do is you describe. So the weakest in the card is case report. We have to arrange the studies like this. Case report. Then you have case series. Then you have the analytical. Analytical mein the weakest is ecological because of ecological fallacy. Then you have cross-sectional. Then you have case control. Then you have prospective cohort or a longitudinal cohort, prospective cohort. Then you have a retrospective cohort, which is better because it saves money, saves time. Then you have a RCT, randomized control trial. उसके बाद क्या होते हैं guys? After RCT, you have a systematic review, and the gold standard or the best one which provides us maximum evidence to establish causality is meta-analysis. So I asked you the weakest, सबसे weak study design. इसमें lower in pyramid क्या है? Ecological. So what is it? Ecological study design. Meta-analysis is the gold standard of EBM. David Sackett was the is the father of EBM. David Sackett, okay, the father of EBM. Alright, don't try to just follow the order. सबसे पहले there's a new disease, we describe it. So descriptive में case report, case series. Then we have ecological because we are not studying individuals, we're looking at populations. So ecological. Cross-sectional. Cross-sectional I can't establish temporality. Case control, prospective cohort, retrospective cohort, RCT, SR, MA. Okay, now 2 things are left, 3-4 numericals and compilation of the buzzwords. Okay, so stay with me. First numerical coming up. Are you ready for the numerical, everybody? Take your time, no rush. Rule of the numerical is to remember the formula first. देखो question क्या पूछ रहा है. Try to remember the formula. What was the formula for it, and then try to solve it. Take your time, guys. I am in no rush. Gaurav का आंसर आ गया. Very good, Gaurav. Gaurav, I don't know whether Gaurav's answer is right or wrong as of now, but Gaurav has come up with an answer. Let's see everybody else's answers. Aviral has come up with an answer. Let's wait for a couple of more answers. Sandesh, good. Utkarsh, very good, guys. देखो, rule to solve numericals. Approach to solve numericals. Do not panic. Do not panic. It is 1 mark. You have to get that mark. I will make you practice. Remember formula. Remember, you have to have the formulas on tip, guys. Remember formula. Now see what the question is asking. Risk ratio. What is risk ratio? Risk ratio is the other term for what? Relative risk. Everybody remembers? Remember the formula of relative risk. What is it? Incidence. Incidence you calculate from a cohort study. So incidence among exposed divided by incidence among non-exposed. Incidence among non-exposed. Okay. Now don't get very worried about the length of the question. Tata Memorial Hospital, koi bhi hospital ho, conducted a cohort study, I know, on 7,000 subjects who were smokers over a 10-year period. That means how many are smokers? 7,000, and found 70 subjects developed lung cancer. Concurrent evaluation I have done from general population in the catchment area of the hospital. Okay, out of 7,000 guys, how many have we found? Non-smokers. Only 7 developed lung cancer. So what is incidence among exposed? How many are exposed? Exposed are also 7,000. Out of them, how many developed cancer? 70. How many are non-exposed from the general population? 7,000 again, non-smokers. How many developed cancer out of them? 7. So do you need a paper pen? No. 7,000 automatically cancelled. 70 by 7. 70 by 7 is nothing but 10. Simple. That means relative risk more than 1. So it is what? It is a risk factor. So don't panic. Your answer might be, everything might be just right in front of your eyes. You just have to figure out. Okay, I was asked risk ratio. I know it is calculated from cohort, incidence exposed by non-exposed. Let me see what is given to me. ठीक है? Another question? करो. Okay, today the session is extended a bit. Okay, no problem. Nahi Pratiksha, Hamesha, I told you in the question before also, relative risk is risk ratio. Odds ratio is cross product ratio. Odds ratio case control study design se aata hai. Aap hi answer? Very good, very good. Now attributed to smoking, that means I had to calculate AR, attributable risk, and I've already told you what is the formula for attributable risk, guys. Incidence exposed minus incidence non-exposed, okay, non-exposed divided by incidence exposed, as simple as that. Now if you see over here, incidence rate of lung cancer among smokers is 10 per 1000. So very clearly I can make out that incidence among exposed, how many are exposed, guys? 1000. So what is the incidence among them? 10. And what is incidence among non-exposed? Incidence among non-exposed, how many are non-smokers? Is 1 per 1000. So it's already written. So what is it that you have to do? 10 per 1000 minus 1 per 1000. इतना करने का ज़रूरत ही नहीं है. You can easily see 10 minus 1, 9 per 1000. है ना? This will come out 9 per 1000 by 10 per 1000. So 1000 cut. This is actually 9 by 10 into 100. Attributable risk is always given in percentage. So this is what? 90%. Don't get caught into the thing that, oh, I'll have to make a 2 by 2 table. Not necessary. You just have to figure out what you have to calculate. From here, you had to calculate attributable risk. Remember its formula. Incidence exposed minus non-exposed by incidence exposed. That's how you'll be able to do it. Got it? Everybody? Pure maths. थोड़ा बहुत maths तो है, बहुत ज़्यादा maths भी नहीं है. Quick, I want this as quickly as possible. As quickly as possible, guys. 5 more minutes on the clock. What is the answer to this? Simple है ना? Relative risk, again, incidence among exposed and non-exposed. कुछ करना ही नहीं है यहाँ. Incidence among exposed divided by incidence non-exposed. Incidence non-exposed. So you can make out incidence of disease among exposed 20 by 4. Answer is 5. Simple. Risk factor. Last एक और numerical. चलो. Odds ratio calculate कर लो. Then you will be done. I'll give you one more numerical and then I'll sum up the buzzwords. Okay. What's the answer to this? That was an easy question, so I skipped to this one. Try करो पहले करने का, guys. This you have to figure out the 2 by 2 table, guys. ये किसका आंसर बता रहे हो? सारे को C कैसे आ रहे हैं? Everybody is coming up with C. Anybody else with a different answer over here? Anybody else with a different answer? Why have you all calculated? Or is it just that, okay, we love the number 50. Chalo, 50. 50 पे mark करते हैं. Yes, I will. We have a formula class. Don't worry. Karo, solve the question. Take a paper and pen. Solve it. No problem. It will give you the habit, the practice. अब सारे कैसे के 20 आ रहे हैं? अच्छा. Anybody else? Raj has come out with A. Nitya has come out with A. Kalgi, Dr. Kalgi has come out with A. Ravi, don't worry. Chalo. What is the answer? Dekho guys. Again, disease, or we can write it cases. It is only for practice. This might not come up. I just want you to revise the formula of odds ratio. Cases, controls. ठीक है? And here it was written lung carcinoma and smoker. Smoker, non-smoker. I have told you many times, outcome is on the column side, exposure is on the row side. And what is the order of ABCD? You can't forget. It is a Z. It is never a no. ठीक है? It is always a Z. Odds ratio होता है cross product. Okay, Ashwin ready? Everybody ready? Stop doing it. Look at me once. Now see, whenever you get a numerical, the outcome will be on the column side and the exposure will be on the row side. A, B, C, D. It's always a Z. It's never a no. So you have A, B, C, D. Odds ratio होता है AD upon BC. Let's see what has been given to us. Even if you can't draw a 2 by 2 table in the exam very often. So you will have to try to figure out 35 cases of lung carcinoma. Now where will you put 35? What is 35? It is cases of lung carcinoma. So where is 35? Yahan. And 82 controls. So where is 82? Yahan. On taking history, 33 cases had positive history of smoking. So smokers, how many? 33. And 55 individuals among controls had positive history of smoking. So where is 55? Here, next to the smokers. Now what is C? C क्या हो जाएगा? 2. And what will be your D? 82 minus 55. So that will come out to be 27. Now odds ratio is 30 AD upon BC. So 33 into 27 by 55 into 2. I know it's difficult to do it manually. I am not here to scare you. मैं बस तुमको, I just wanted to show you the use of numbers. Maybe they will give you easy numbers, which you can do it. ठीक है? All I wanted to revise over here was the 2 by 2 table. Am I clear, everybody? Why so much of silence? Don't get scared of the numericals, guys. ये नहीं आएगा. It is just to make you practice. ये ठीक है. That means कि odds ratio का formula क्या होता है? AD BC. All you have to figure out what is AD. You might get easy numbers, but you will have to notice कि ठीक है. If it's written 35, if it was written 50, so where is this 50? You should know it is cases. So A plus C. What is this 82? It is controls. I am just trying to show you the use of numbers. Don't lose heart over here. ठीक है? Yashwin, that's why you have to remember the formulas. No, I am trying to. I'm here so that I'll give you a question tomorrow also, so that you can practice. Okay. All right. Chalo, let's do the buzzword game now. Let's do the buzzword. Don't lose heart and hope. Tomorrow again would be numericals. Now, if you ever see the word burden or load, which type of study design are we referring to, guys? Burden or load? As quickly as possible. We don't have much time today. Burden and load. If you have to find out the burden, what is it? Very good. Cross-sectional. Prevalence and survey. What is it? You're looking for cross-sectional. Okay? Retrospective effect to cause odds ratio. ये क्या है? This is case control. Prospective cause to effect follow up. If you see the word follow up, this is cohort. Incidence study. This is cohort. Multiple exposures. Multiple exposures किससे पढ़ोगे? Effect to cause. Cancer, no cancer. Did you smoke? Did you drink? Did you eat junk food? So multiple exposures, case control. Multiple outcomes, cohort. Rare disease, case control. Rare exposure, cohort. Let me give you a couple of more buzzwords. Matching, case control. Past records, ओल्ड डेटा, इसको मैं दूसरे पेज में लिखती हूँ, लास्ट पेज आई विल टेक ओवर हियर, सॉरी past records, old data, comparison, exposed, non-exposed, exposed versus non-exposed, retrospective cohort, ठीक है. Comparison, diseased versus non-diseased, questionnaires, interviews, what is this? Case control. Okay, फिर same point, primary data, what is this? Cross sectional, burden, survey, cross sectional, same point. Secondary data, population, unit of study, what is this? Ecological. Okay, distribution, new disease, what is this? Descriptive. Best study design to establish temporality, best study design for temporality, cause precedes effect. You smoke, then only you go on to develop lung cancer. Cohort. Kal I'll teach you natural history. Best study design for natural history of disease. Kal padhenge. Natural history. Again, cohort. ठीक है? Temporality means and gold standard of evidence-based medicine, meta-analysis. If you ever see the word causality, guys, for causality you have to follow EBM. If you see that weakest study design to establish causality, strongest study design to, you have to follow EBM. Clear? So I think we've taken a lot of time today. I hope you understood, guys. Go through the session once again, everybody. It would be really helpful for all of you how to differentiate between the study designs. किसी को कोई भी doubt हो, you can ask, or you can put in the question and ask me tomorrow as well, or send it to me on Telegram or Instagram. I will go through it and I will bring it in on the next day. If you find any question tough, you can ask me. I can put it out on the next day for everybody to see. Tomorrow is health and disease, where we're going to discuss a couple of indicators, a couple of level of prevention, epidemics, natural history. Okay? But tomorrow we're going to keep it a little shorter session because you have a lot to study, guys. So don't... depression, manav, depression with social media. Ab depression mein, what are you comparing is very important. If you are comparing depressed, non-depressed, it is case control. Depression is the outcome, social media is the exposure. And depression is something which is rare. Clinically diagnosed depression is not very, we won't see people with a certificate, with a doctor's prescription. So you start with people who are depressed, non-depressed. Ask them about their social media usage. ठीक है, please go through these sessions once again. Finish up it today itself. Just spend more another 10 minutes and I'm sure everything will come back to you. Okay, so I'll see you tomorrow. Remember the buzzwords and the questions would be very easy. Remember the comparison groups, remember the buzzwords, remember the try to remember the formulas, and it will all come easy to do. So I'll see you tomorrow. Quasi experimental hota hai. See, quasi experimental. If you look at this word, no, झूठ का experiment. Quasi means false. झूठ का experiment, false experiment. So it is experimental, all right? It is experimental, but without randomization. When I say without randomization, that means there is no randomization. That means there is no picking of chits. There is no picking of chits. But there is still an intervention, like disaster. Now, As an investigator, I did not make people become victims of disaster. मैंने नहीं बोला कि तुम earthquake के victim है कोई और कोई नहीं होगा. But I took opportunity of that situation. I did not make anyone pick up a chit. So there was no randomization. There was no table of random numbers. There was no flipping of coin. But using a natural phenomenon, disaster एक natural phenomenon है. So using a natural phenomenon, automatically two groups formed, people who are victims of disaster and those who are not. That is quasi-experimental. Like John Snow's experiment, okay? John Snow is father of epidemiology. Now John Snow's experiment was an example of natural experiment, okay? The one that he studied, cholera epidemic, London. Migration is an example of natural experiment. There will be people who will migrate. I did not ask anybody to migrate. So intervention is happening, but there is no picking of chits. ठीक है? When we actually can't do situations by ourselves, we depend on nature for them. So there is no picking of chits happening, but the people are automatically getting divided into two groups. Got it? Chalo. So I'll see you tomorrow. Bye-bye. Have a good day. Keep studying, keep revising. Do not give up. See you all tomorrow, same time, same place. Bye-bye.